Hello everyone, Dr. John Bartemus here with the mother of a functional medicine Charlotte client. This is Marianella, and Marianella, why did you first bring Wyatt in for care?
We brought him in because he had Crohn's, and he had gotten diagnosed the year prior, but we had done the traditional medicine or conventional medicine route, and our doctor basically gave him the diagnosis that his treatment for the rest of his life would be a liquid diet and drugs for the rest of his life. 90% of his diet would be liquid.
And how old is he?
He's 13 now. We started this right before he turned 12, but we noticed back in 3rd grade that he had stopped growing, his skin was turning gray, he couldn't gain weight. He had gone from like the 50th percentile in weight to like 8th percentile, so he wasn't thriving.
Okay. And so you didn't want to do lifelong drugs and liquid diet, so how did you find functional medicine?
I Googled it.
Okay.
I Googled it and I found your videos and I just started watching, and then I found a video you had done with a Crohn's patient you had already had, and I just have a more natural bent of what I want to do in medicine, and so I knew that I loved functional medicine as a whole and the way they treat it with the natural, but also having lab tests and being able to see what's going on, on paper. Okay. Through the videos.
Okay, awesome. So you brought Wyatt in, and we tested objectively, like she said, to determine, first of all, was it Crohn's, and it is Crohn's, and then multiple other tests to determine specific to Wyatt where are the areas in him that we needed to address. So what did he weigh when you first came in? Do you remember?
He was 68 pounds.
Okay,
he started at age 12.
At age 12. Okay, and what was a typical day like?
He was drinking Ensure for breakfast, lunch, and all the snacks in between, and then he would have a dinner. But the problem was, because he was on this liquid diet, it was starting to make him more and more sensitive, and also its first 5 ingredients, I think, are sugar.
Yeah.
So his it started to get to where he couldn't eat like healthy food. He would bleed when he ate an apple. He would bleed when he ate salad. He would bleed when he ate pretty much anything at that point. So he was starting to decline quickly.
Okay, and then from a nightly routine in the bathroom.
Yeah, he would be, from the time we got home from school, he'd be in the bathroom for 2 hours until it was time to go to bed, off and on, and just bleeding or diarrhea, or just waiting for something to happen, because he'd have the sensation to go and then nothing would come, and he'd just have to stay there till something happened.
And pain?
Yeah, he had pain.
Okay. So not a way to live as a 12-year-old, and probably not something a parent enjoys to watch. And so we figured out what was wrong and we addressed it. And so what have you noticed since?
He is thriving. We have actually, when we started this, we started doing this specific carbohydrate diet, which 3 days in, going to the bathroom for 2 hours ended. That just ended. His pain went away, and then we did the diet plus all the supplements that you all day long. He was on supplements. But at 6 weeks, so I think one of the things that's most notable was his all the testing that you did. All the things that our regular GI doctor never tested for, which anemia, blood sugar. His blood sugar, his A1C was 5.9, which that had me really worried. Vitamin D, all these different things that you supplemented for, his personality just blossomed. He became so cheerful and so lighthearted and joking, and I think it's because he was just feeling good, but we've seen his weight gain. He's now 92 pounds, so he went from 68 pounds to 92 pounds.
Wow.
All the things that should happen in a 13-year-old boy, he's...
Go ahead and share them.
Yeah, his voice is changing. His teeth had stopped falling out, or, stopped losing teeth because everything was just on lockdown, and now his teeth have started to fall out, new teeth are coming in. He's grown in height. He's thriving. He can eat an apple now with the peel and not bleed. He hasn't bled since we've been doing this. So he bled once because of one of the antibiotic treatments you were doing, but he can eat whatever he wants on this diet, and it doesn't have to be peeled. It can be raw. He can handle it. So
So
He's eating normal food.
that's awesome. That's
Yeah.
awesome. And what that says is that the intestinal lining is healing. So he can digest and absorb like he should be able to, and
Yeah.
then therefore
and the color in his face, like he's gone from being gray with no color and dark circles to he's got rosy cheeks and he looks healthy.
awesome.
So
So, what would you say to a parent who is on the fence and
Do
wants to
it.
stick to the conventional side?
don't do it. This is the way to go because it gets to the root cause. Because the things that were tested for in Wyatt that were never tested for with conventional medicine, you found bacteria that was like a major cause of all the pain he was feeling, and it's like we were working to wipe that out, but it's like, if we had stuck with our regular path, we'd probably be looking at surgery by the end of the year, or definitely medicine. We were fortunate to avoid any medicine with our conventional medicine doctor. I would just say do it. I mean, this is the way to live. It's real food. We're on no drugs, and he's healing. So I just think it's the way to go.
Awesome. Awesome. So if you or a family member or loved one is suffering from Crohn's disease or another chronic or autoimmune disease, functional medicine oftentimes has a solution for you. So I encourage you to keep digging in the YouTube channel and on the podcast and elsewhere on the internet. And when you're ready, give us a call. Marianella, thank you so much for sharing your story. Have a great day.